Hi, my name is Pamela. I am doing a video submission for Stephen Wong for Nursing Foundations for our lab assignment. So my patient has already been prescribed or diagnosed with a UTI. She's already been given she's already been given a prescription. My dog, sorry, has already been given a prescription for treatment for it. So now I'm going to do my pre-assessments for my patient. So my pre-assessments would be my OPQR-STUV for pain, and the patient has already stated the range is a 5 out of 10. I'm going to check for vital signs. So I'm going to check for it's all within the normal ranges. But my blood pressure systolic normal range is 90 to 139. My diastolic is 60 to 89. My respirations are 12 to 20. My pulse the pulse rate would be between 60 to 100. Saturation levels would be 95 to 100, and my temperature would be 36 to 38 degrees. So I would also assess my patient for dysphagia to make sure that they weren't going to have any difficulty swallowing their medication. I am also going to assess to make sure there isn't any prior allergies or reactions to penicillins or any other cephalosporins prior. I realize that there is a reaction or there is an allergy to sulfa in cats, so sulfonamines would be an allergy, but that is not what the patient is being prescribed. So I'm going to check for the safe dosage, if this is what is able to treat the patient. So the safe dose is for an adult is PO orally is 250 milligrams to 500 milligrams every 6 hours. So this is a safe dose that has been prescribed. So therefore I'm going to check my physician's order, against my MAR. So first I'm going to start with the patient label. It says polka dot. The MAR says polka dot. Physician's order says date of birth, August 4th, 1979. Patient label on the MAR is date of birth, August 4th, 1979. There's prescribed cephalexin, 500 milligrams, PO every 6 hours. On my MAR, it states cephalexin, 500 milligrams, PO every 6 hours. So starting at 0600 hours, 1200, 1800, and 2400 hours. So this is the safe dose. And this is, I verified that. So now I'm going to go to my medicine cabinet, and I'm going to pull the medication. So I'm going to pull the cephalexin. So I'm going to pull the bottle. So I'm going to check my patient label. Patient polka dot. Patient label is polka dot. Name is polka dot. Date of birth August 4th, 1979 on my MAR. Date of birth August 4th, 1979 on the bottle. The medication is cephalexin, 500 milligrams. I have cephalexin, 500 milligrams to be taken by pill in tablets. So I have the right medication. So I'm going to make a patient label. And I'm going to pull and put the medication into the container. So now I'm also going to check my expiry date. Expiry date is January 2024. So we are safe there. So now I'm going to do my second medication check. I'm going to put that bottle away. So now I'm going to check to my MAR. So on my patient label, polka dot, date of birth, August 4th, 1979, date of birth, August 4th, 1979, polka dot. The medication on the MAR is cephalexin, 500 milligrams by pill. So This medication is cephalexin, 500 milligrams. It's tablet form, so it is taken orally. Every 600 hours is safe time. There has been no previous dose. So now I'm going to do my third check. So I have Polka Dot, date of birth, August 4th, 1979. Polka Dot, August 4th, 1979. Cephalexin, 500 milligrams. PO every 6 hours. Cephalexin, 500 milligrams. Is in tablet form, so it can be taken orally. And the time is 06. There has been no previous dose. The first dose can be at 0600 hours. This medication is safe to give. So now I'm going to go to the bedside. So now I'm going to check my medication label. Sorry, I just need to get a good angle here. Check my medication label. So the name is Polka Dot. Polka Dot is on the medication label. Date of birth, August 4th, 1979. Date of birth, August 4th, 1979. I'm going to ask my patient to verbalize their name and birth date for me. So now I'm going to use hand sanitizer. And I'm going to explain to my patient that this is an antibiotic. It's used to treat the UTI. And I don't know if I can get this. Okay, so it's used to treat the UTI. It's antibiotic. The most is important to take the medication right and finish the medication, even if you're starting to feel better, because you don't want this to become a superbug or to get worse or come back stronger. So even if you're feeling better, you must complete the medication. The normal side effects are some abdominal cramp, maybe diarrhea, and or vomiting and nauseousness. If the patient experiences any rash, wheezing, trouble breathing, or blood in the urine or blood in the stool, they need to notify somebody on the healthcare team immediately, so to let someone know right away. And I'm ready to give them their medication, so that I've demonstrated the patient the teachings, and the patient has the understanding and the right to refuse at this point. So I'm going to pop the pill into the tablet. I'm going to give them a glass of water. They can take their pill, swallow it, and then immediately I'm going to mark it on my MAR. So I'm going to put the month is May 30, 2021, and cephalexin at 0600 hours. I'm going to mark it on my MAR. So I'm going to make sure side rails are still up. Patient has swallowed her medication. You can give this medication by pill, or with water, or with food. It is entirely up to the physician. That doesn't state on the order. It does help with food because it helps slow down the GI motility a little bit. But anyway, so it's been recorded. So I'm going to make sure the side rails are up. The call bell is in place. And I'm going to come back and check on my patient to monitor to make sure there's no allergic reaction. So my future modifications for this would be to definitely practice this more, out loud, and get used to doing this so that it's more like a second skin doing it. I think the thing that did go well was the looking into the medication beforehand to know what to look for and how to explain it properly to the patient. And I didn't do as well as memorizing, so I do think I need to practice on that. Thank you.